Hi, everybody. Welcome to Dr. Christine Anderson, chiropractor, my show, Optimal Health, Optimal Life. And sorry, I'm coming in a little bit late today. I was trying a new format on StreamYard and I wasn't seeing video. So I thought I would come back in on YouTube and the show from here. Just adjust my lighting. That's a little better. Okay, so we're talking about knee health and who out there has had knee issues, right? I certainly have had my share, and I will talk about that with you as we go on tonight when I'm talking about issues. And if you have questions, you can type them in the chat and ask your questions or say hi. And yeah, let's just dive right in. For those of you who don't know me, I am a chiropractor in Los Angeles. I have a family practice, so I see a lot of kids. I am board certified in pediatrics and pregnancy. And it's really great because families pile in and I help take care of the whole family and help them grow up healthy. So that is my passion. That's what I love to do. So let's dive right into knee anatomy. Now, I was hoping to have a really cool thing where I could share my screen, but that is not so. I have my trusty iPad, and hopefully I won't get too big of a glare. But I just want to show you, this is the front, side, and back view. So there's the front right there, side and back view of the knee. You're going to see the femur, the tibia, the fibula, and the patella. So those are the main structures that we're going to be talking about. So I wanted you to get a good visual of that. And the tibia, that's the shin bone, the major shin bone, carries about 80 to 90% of our weight. A little bit is carried by the fibula, and it can still create problems, but if things happen with the fibula, usually you can still walk, unless like a patient recently actually fractured and broke the part near her ankle, because it does create the outside ankle bone, that fibula bone. And her whole leg was bruised, and I took x-rays and she had it broken. So she felt better after I adjusted her. I didn't touch the part that was broken, obviously, but working around, because she had tripped over a cord and fell in a weird way and broke that fibula bone. But the part of the hamstrings actually attaches to that fibula bone. So when it's possibly out of alignment, that I sometimes see with people, it's subluxated, it's out of alignment, and they have pain when they're walking because that hamstring muscle is kind of pulling on it. The kneecap or patella, it actually acts like a guide for the quadriceps tendon. So I'm going to talk a little bit more about the muscles, but let's just have a quick look at that. So that's the patella with this tendon over it. This is actually the tendon of the quadriceps. And you know that bump on your shin bone, like right below your kneecap? That's a tuberosity where this tendon attaches. And that's part of the reason why it's so big, is because that tendon pulls on it and creates tension. And that can create a problem sometimes that we'll talk about. It has to glide in a groove. So let me go back to that first picture of the knee bone. So if you look here, this tendon, this patella has to glide in between what are called condyles. And if it doesn't glide properly, it can create problems. It can create friction, it can create pain, and it can create imbalances in the knee. So that bone is really important when it comes to balancing the knee movement. Now, in between the joint is cartilage, and cartilage is a substance that lacks blood supply, so it's really hard to heal. This is part of the problem with cartilage. But it's flexible, believe it or not, and it's slippery, and there's a fluid in there called synovial fluid, because this is what's called the synovial joint, that helps to lubricate the movement of the knee. And again, this is where some problems can occur If you have degeneration, that cartilage starts breaking down, maybe the fluid isn't adequate enough to stop the friction. And if that flexibility of the cartilage is lost, you're going to lose some of that shock absorption that is part of the function of it. The meniscus. So there's a couple of joints in our body that have these little menisci. That's the plural. It's sort of little cartilage. It's almost like the disc in our vertebra, right? They act as shock absorbers and cushions between the joints. Well, menisci are very, very similar to that. They're a little bit different in structure, but sort of their function. And in the knee joint, they sit on each condyle, and they sit between those two condyles, and you'll hear lateral and medial. This is a medical term meaning medial is towards the middle, lateral is towards the outside of the body. That's all that means. All right. So what these menisci do, again, it's acting as a shock absorber. And we're going to talk a little bit about the meniscus in a second. And then there's ligaments. Now, you've heard me say this about the joints. Where you have a joint, you're going to have ligaments. That's just the nature of the body, because what ligaments do is their function is to hold you together. They're attaching bones. So you're going to see ligaments always at joints, and it helps try to keep that joint stable and only move it how much it's supposed to be moving and not beyond that. And this is a problem for people who are very flexible and have loose ligaments and kind of move their joints beyond what is considered a normal range of motion. I mean, there are hypermobile people, but that over mobility, if they don't balance it with strength, and can again create problems for the knee if it's just sort of moving all over the place, especially with things like walking or something more high impact. So we have those ligaments. There's a whole bunch of those ligaments in the knee. You'll hear like lateral, collateral ligaments. You'll hear anterior cruciate ligaments. You'll hear posterior cruciate ligaments, cruciate meaning cross. So these are ligaments that cross between the femur and the tibia in the knee. And there's one in the front, which is anterior, and there's one in the back, which is posterior. So it's going to actually limit rotation. So we have a little bit of rotation in our knees, but it limits that motion. And depending on where it is, where that motion is. And then we saw that we have the tendon to the quadricep. Well, we also have a ligament to the patella, and it kind of limits, again, how much we can bring our leg out into a straight position, okay? We have a joint capsule. So again, it's something trying to hold our joint together. It's thick, it's fibrous, it wraps around it. It's kind of like, think of like an ace bandage wrapping around it. And then inside that is where that synovial fluid is contained so it doesn't leak out, right? We need that capsule. There's bursa. Bursas are kind of like our cushions, little bits of fluid that go in between spaces that there might be friction. Think of it like when we get a blister, if we have friction from walking like in shoes that we're not used to. Well, this is what this is preventing. It's kind of preventing a blister occurring in our joints. All right, so let's get to the movement. The basic movements of the knee are flexion and extension. That means that you're straightening your leg and you're bending your leg. When you straighten your leg, you're engaging your quadriceps. When you are bending your leg, you're using your hamstrings. And so in the front part here are our quadriceps. There's 4 quad, but you can only see, here is 1, 2, 3, sort of on the 4th there is a little bit. And then let me show you the hamstrings. There's actually 3 hamstrings, and they attach to the side of the knee, okay? So you get sort of an idea because the hamstrings are attaching to the side so they can pull the knee back, and then the quadriceps are extending our leg forward. Now, there's also rotation. It's minimal. There's different muscles involved in that, sort of like when you're going to sit cross-legged. I'm not going to talk too much about them, but all of these muscles are supposed to move our knee in the direction they're supposed to. And then we have the iliotibial band. So ilio meaning the hip, the ilium, the tibia. We just talked about the tibia in the knee. It's that bottom part of our shin, and it's on the side of the leg. And anybody who has done any foam rolling on their leg really knows their iliotibial band. And I find this entity, or IT band you'll hear, is super important for our knee health, because if it is tight, it is going to pull on that side part, that lateral part, and create imbalances in movement. And there'll probably be a lot of pain. And there's usually a lot of pain when you start working on it, whether you're getting deep tissue massage or you're using a foam roller, because when it's tight, it's lacking circulation and hydration. So as you keep working with it, it will get better and better, I promise. But it's this extension of the tensor fascia lata, which is at the side of your hip, and the glutes, which is your butt, right? And then down into that fibula that we talked about. That's where it also starts attaching. All right, so let's talk a little bit about problems in the knee. So the knee is vulnerable to injury as it bears an enormous amount of pressure while it's also being flexible and moving at the same time. So when we walk, the load on our knees is equal to 1.5 times our body weight. Okay, that's quite a bit, right? When you're climbing stairs, it's 3 to 4 times our body weight. And when you squat, the load on your knees increases to about 8 times your body weight. So positioning matters. And if you are moving, this is why the alignment of your knees matter, because if your knees are walking in or turning out, then you're going to put different stresses and loads on different part of the knees. And this is where you're going to start to see problems. So though that movement is something that I look at, that we'll talk about when I tell you what I do when somebody with knee issues comes in, but really I'm looking, even if they don't complain of it, I'm still looking at their knees in my exam. And what I often see is that knee issues are usually secondary to other issues in what we call the kinetic chain. In other words, your hip bone's connected to your knee bone, connected to your foot bone, right? So it could be an issue with the low back, the pelvis, the hips, the feet, and the knees often get stuck in the middle. They just are bearing the brunt of all these issues. And then because of those weights I just talked about, especially if you're moving and exercising and playing sports, they're going to be more vulnerable. And that's not even with an injury. All right, so I'm going to run down some of these conditions that are quite common. Number 1, osteoarthritis. This is the one people talk about, like wear and tear or arthritis of old age. I don't like to call them that. I call it, there's something going on in the body that's imbalanced, and your body we have this state, especially in our skeletal system, of breakdown and repair. And in the case of osteoarthritis, it's the fact that you're breaking down more than you're repairing, and so that joint starts to degrade in true osteoarthritis. So this can be from an injury early on in life. It can be from a fracture. It can be from a sports injury. It can be from overuse if you're not using your body properly or there's imbalances. And it may or may not be asymptomatic, and it may or may not show up on x-ray. And this is the hard thing, because it takes time to show that breakdown of bone and build up of the degenerative process on x-ray. It takes about 15 years. So you may not see anything at first, or the pain may not be proportional to what you're seeing on x-ray. You might have a lot of pain, little x-ray, You might have a little pain and like a lot of stuff happening on x-ray. So it's not really this cut defined, if you have this, you have that. But typically, okay, there's going to be pain, swelling, maybe stiffness, and it's usually worse after activity with osteoarthritis, okay, because it's getting irritated. I'm going to mention really quickly this one because of the fact that I am a pediatric chiropractor, and it's called Osteochondritis Dissecans. Oh my gosh. This is often seen in children and adults, and it occurs when there's a small segment of bone that begins to separate from the rest of the bone, like creates an island area because of a lack of blood supply. Now, in most cases, everything will heal on its own with rest. So this is not something that's typically creating large problems, but just something to be aware of, especially if you have children and adolescents. And really, basically, guys, if you have children and they have pain, they have spinal pain, they have extremity pain, they have pain anywhere in their musculoskeletal system, there's something going on. It's really a sign to get them into a pediatric chiropractor and get it checked out, because kids in general don't have pain for no reason. All right? Cut and dry. That's it. All right. Chondromalacia patellae. Now, there's, sometimes they rename things, but this is actually the name I know. And what they say is chondromalacia is, the malacia is softening, chondro meaning cartilage. So it's supposed to be like softening of cartilage on the underside of the kneecap. Well, I look at more as a breakdown of the cartilage because that kneecap is not tracking properly in that groove. And that could be for a variety of reasons. But most of the time I see it's an imbalance in the muscles going on and that iliotibial ligament. So anyway, usually there's pain when there's bending and straight, and especially with bending. Anytime it's a sport with bending knees, or when they go to bend and pick something up off the floor. It could be dull and achy. You can feel the grinding. There's actually an orthopedic test that elicits this grinding. It's not fun, but it definitely is the way to tell if this is what's going on. All right. Now, this is common with people who are young, people who are athletic, who are using their knees a lot. So this is something that is super common, and it's something that's really easy to check. And it's actually not hard to help heal. All right, rheumatoid arthritis as opposed to osteoarthritis. Rheumatoid arthritis is inflammatory in nature, and generally it is due to an autoimmune process. So I'm not going to talk that much about it, except to say the pain is usually symmetric. In other words, it's on both sides. So rather than, somebody who comes in with one knee hurting, it's both knees that are hurting, which kind of differentiates it from other arthritises. And there's a whole host of them, by the way. Then you've got all your ligament issues. The anterior crucial ligament, the lateral and medial lateral ligament injuries. And these are, so the ACL injury is a tear and sprain of that anterior cruciate ligament that I can't seem to say. And this one most commonly occurs in sports that involves sudden stops or changes in direction. So maybe some knee rotation in there, right? Because that ligament's supposed to stop that rotation of the knee. So things like soccer, basketball, football, downhill skiing, these types of things. As opposed to the lateral and medial collateral ligament, those are the ones that are on the side of the knees, lateral on the outside, medial on the inside. And so they're supposed to stop the knee from going in or going out. And this is more of again, an athletic injury type of thing where it's a contact sport. So this is the one like, Someone in soccer will do a tackle to the side, like with their feet first, and go right into the shin or the knee bone and push the leg out to the side, and the knee gives, and that lateral ligament will give. So that type of thing. The posterior cruciate ligament will happen with a type of injury that's more like a motor vehicle accident. So your tibia kind of gets pushed backwards, right? Maybe your knee hits the dashboard and things kind of shear backwards, that posterior ligament. So that's those. And then we get to the meniscus. Remember those shock absorbers between the knees. Now this usually occurs because of trauma caused by forceful twisting or hyperflexing of the knee joint. So what I mean by this is there's that hyperflexing is when you're bending your knee really, really hard. All right. And it's, remember though, these menisci are sitting on the side, the middle, and the outside. And sometimes it can heal without surgery. You'll hear people say, I'm going in for surgery for a meniscal tear. It really depends on the grade. I don't want to go in deep into it, but if it's not too bad, you can get away with a brace. All right, we're almost through this, I swear. Where am I going? We are going to patellar tendon rupture. So remember I talked about the quadriceps going over that prominent bone, the tibial tuberosity, and attaching to the tibia at the front. Well, sometimes you can tear that tendon, and this is usually in a young athlete. It used to be males, but now women are stepping up, and it's happening more in females. But it's also happening more in people as they get older, as they remain physically active. So this is definitely an injury for the active person. And it involves like an awkward landing from a jumping position where you're contracting your quadricep muscles. So you're straightening your leg, but at the same time, the knee is still bent, and it's something called an eccentric contraction where that muscle pulls, and it pulls really hard and pulls that tendon right off the bone. It just sounds horrendous, and I'm sure it is no fun. I'm sure they hear a snapping or popping sensation, and I'm sure they can't walk. I mean, it's really a disruption of the whole thing. So we don't want to do that. Don't pull your patellar tendon off. Okay, we talked a little bit about iliotibial band syndrome. It's super common. It's when that outer part of the knee gets super tight because that iliotibial band is compressed. So I'm going to move on to Osgood-Schlatter disease. Some great names, right? This is another pediatric issue. It usually occurs in children and adolescents who are experiencing a growth spurt during puberty. It usually happens again with very active children who are involved in sports that are running, jumping, changing direction, as I said, like with soccer, basketball, skating, ballet, that type of thing. And it's not as dramatic as that patellar issue with the patellar tendon, but it's similar because what's happening is that quadricep is engaging so much that it just keeps pulling on that attachment, and it gets really, really irritated. So they'll have pain and swelling at that tibial tuberosity. And things that you can do are things like resting, ice, compression, elevation, using maybe some KT tape, maybe a brace to help support it while it's healing and just kind of calming down. And this is where they have to sort of lay off sports for a while till it does calm down. But it usually, if we can say it, they usually grow out of it. All right, so What do I do when somebody comes in with knee pain? Well, what I do with everybody, number one, I take a history, right? Got to find out what's going on. Were there any injuries, even way back into childhood, sports, what their exercise and activity levels are. What's their diet like? Have they tried treatments? Anything make it better or worse? Any medications they've tried or alternative remedies, just whatever they're doing. So that's number one. Number two, I look at their posture. That tells me so much. How are they standing? Are they locking their knees all the way back and hyperextending their knees? Are there alterations in what their knees are doing? Do their knees bow in, which knock-kneed, or do they come out, which is more bow-legged? Are their feet turned out or in? Like, what is happening with their whole posture? Because remember, I said those knees are stuck usually in between the hips, pelvis, and the feet. So whatever's going on in that kinetic chain, I have to have a full look at that. I have to look at their gait. What's happening when they're walking? So much can be told by that. I do something called a foot scan. It's a pretty sophisticated device where I'm looking at, it's like really sinking your foot into a foam. It actually looks and takes an image of the foot in 3D. But it's looking at what's happening with the arches. There are 3, and we'll talk more about this next week when I do the feet and ankles. And the weight distribution. So if they're leaning on one side more than the other, that's going to give me some information about stress. Unequal leg length. Is one tibia longer than the other, or is it a femur? So we've got 2 components there that are going on. Orthopedic tests that I do, like I said, of this patellar grinding test. There are other tests I can do to help me figure out what's going on with the knees. Of course, I'm looking at alignment and to see if there's any subluxation or misalignments, and sometimes I need to do an x-ray, and that gives me more information. All right, so for support with a person who has knee issues, I'm going to do chiropractic. I may be doing lifestyle issues like, do they need to change their diet? Do they need to lose some weight? Do they need to modify what they're doing activity-wise? Are they walking or running on pavement that's irritating their knees? Do they need support with some pelvic stabilizers that are custom made for them? Do they need some stretching exercises or strengthening exercises for those imbalances? Do they need to do a foam roller on their IT band maybe, or even their quads and hamstrings? Do they need a brace? Looking at their diet as far as inflammation goes, sugar, that type of thing. Maybe we're looking at some supplements like glucosamine, turmeric or curcumin, essential fats, hyaluronic acid, MSM, which is a sulfur donor, which we need for our joints to that active ingredient of what makes up our connective tissue, ligaments, skin, joints, that type of thing. Would maybe some CBD help them? Maybe some homeopathy, maybe some essential oils. Do they need to rest it? Do they need to ice it? So there's this whole compendium of things I can do, and it really is so personalized because it does depend on what has happened, what problem I'm finding, and then the best solution for that person. All right, so I hope this helps you understand the knees a little bit more. Let me know what you think. Give me a thumbs up if you enjoyed this presentation. Of course, subscribe, because guess what? I've got more exercises coming. I will be putting some up, hopefully later this week. And share please, so that people know what to do for their optimal knee health. And in the meantime, you have a great week. I'm going to see you next Tuesday, 6:30 Pacific Daylight Time right now. And have a great week. And here's to your optimal health and optimal life. Bye, everybody.